Do you feel a deep, nagging pain in your hip that just won't go away? Or maybe a tingling or shooting pain that travels down your leg, sometimes all the way to your foot? If you've been told it's sciatica, but nothing seems to help, you might be dealing with something called Piriformis Syndrome. It's a pesky condition where a small, deep muscle in your hip, the piriformis, gets tight and presses on your sciatic nerve, causing all that discomfort. And that's especially common if you sit for long periods or over 50. But here is the good news. You can find lasting relief, and you don't need fancy equipment or expensive treatments. In this video, I'm going to show you the only 3 exercises you truly need to release that tight muscle, reduce the inflammation, and get rid of that pain for good. These moves are simple, gentle, and incredibly effective. Stick with me, and you'll learn how to do them safely at home so you can get back to living your life without that constant ache. Let's get started. So, what exactly is Piriformis Syndrome, and why does it cause so much trouble? Let's break it down. Deep in your glutes, you have a small muscle called the piriformis. Its job is to help rotate your leg outward. Now, for most people, the sciatic nerve, which is the largest nerve in your body, runs right underneath this muscle. But in some people, the nerve actually passes through the piriformis muscle. So, when the piriformis gets tight, inflamed, or goes into spasm from things like prolonged sitting, overuse in activities like running, or even an injury, it can squeeze or irritate the sciatic nerve. This compression is what leads to that classic deep buttock pain, the tingling, numbness, and sometimes sharp, shooting pains down the back of your leg. It's often misdiagnosed as general sciatica, which is usually caused by a spinal issue like a herniated disc. That's why typical back treatments might not work for you. Understanding that the root cause is this specific muscle is the first step to finally fixing it. Now that we know what we're targeting, let's get into the first exercise that will start providing immediate relief. All right, let's dive into our first exercise. This is a gentle hip stretch that's perfect for beginners and anyone experiencing a lot of sensitivity. We want to start by gently encouraging the piriformis muscle to relax, not force it. You can do this sitting on a sturdy chair or lying on your back on a mat. Let's start with the chair version. Sit up tall with your feet flat on the floor. Now, take the ankle of your painful leg and place it over the opposite knee, creating a figure 4 shape. If this already feels like a deep stretch, just stay here and breathe. Your goal isn't to push through pain. To deepen the stretch, you can gently lean your chest forward, keeping your back straight. Imagine you're trying to bring your belly button toward your shin. You should feel a nice, gentle pull deep in your hip area. Hold this for about 30 seconds, breathing deeply the entire time. Deep breaths help signal to your nervous system that it's safe to relax. Now, slowly come back up. We'll repeat this 3 times on the affected side. Remember, the key here is to be gentle. We're just coaxing the muscle to let go. If you prefer to do this lying down, the motion is the same. Lie on your back with your knees bent, cross your ankle over the opposite knee, and then gently pull the supporting thigh toward your chest. Find what feels best for you. Now for our second exercise, which is all about activation and release. It might seem counterintuitive to activate a muscle that's already tight, but this technique, called reciprocal inhibition, is incredibly effective. When we activate the muscles that oppose the piriformis, it helps the piriformis to relax and let go. We're going to do a clamshell exercise, but with a specific focus. Lie on your side with the non-painful side down. Bend your knees and stack them on top of each other, keeping your feet together. Your hips should be stacked vertically, too. Don't let your top hip roll backward. You can prop your head up with your hand. Now, while keeping your feet touching, slowly lift your top knee toward the ceiling, as if a clamshell is opening. Only go as high as you can without your pelvis rocking back. The movement should come from your glute muscles. You'll feel the muscles on the side of your hip working. Hold it at the top for a second, and then slowly lower it back down with control. We're aiming for about 10 to 15 repetitions. The focus here is on slow, controlled movement. By activating these hip abductor muscles, we are sending a signal to the piriformis to release its grip on the sciatic nerve. It's a smart way to trick the muscle into relaxing. Do this exercise on both sides to maintain balance, but really focus on that smooth activation on the painful side. Our third and final exercise is a powerful combo that focuses on both mobility and strengthening to ensure the piriformis doesn't just get tight again. This is called a hip bridge with abduction. This move not only strengthens the glutes, which are the main supporters of your hips, but also actively stretches the piriformis. Lie on your back with your knees bent and your feet flat on the floor, about hip width apart. Place your arms by your sides. First, squeeze your glutes and lift your hips off the floor until your body forms a straight line from your shoulders to your knees. Don't arch your back. The work should be done by your glutes. Now, hold this bridge position. From here, slowly let your knees fall out to the sides, just a few inches. You'll feel a stretch in your inner thighs and a gentle activation in your outer hips. Then, use your glute muscles to pull your knees back to the starting position. Finally, lower your hips back down to the floor with control. That's 1 repetition. Let's do 10 of these. This exercise is fantastic because it strengthens the gluteus maximus, which helps take the pressure off the smaller piriformis muscle, allowing it to do its job without getting overworked and tight. It's a proactive way to build a strong, stable foundation for your hips. Now that you have these 3 core exercises, let's us talk about some bonus tips that will make a huge difference in preventing piriformis pain from coming back. It's all about your daily habits, especially how you sit. If you sit for long hours, make sure your feet are flat on the floor and your knees are at a 90-degree angle. Avoid crossing your legs, as that can shorten the piriformis muscle. And definitely don't sit on your wallet. Keeping a thick wallet in your back pocket can create an imbalance in your pelvis and directly irritate the piriformis muscle. Try to get up and walk around every 30 to 60 minutes. A quick walk to the kitchen or a few simple stretches can reset your posture and give that muscle a break. Also, pay attention to your posture when you stand and walk. Try to keep your weight evenly distributed on both feet. These small adjustments throughout your day reduce the constant strain on your hips and can be just as important as the exercises themselves. Think of it as creating a pain-free environment for your body to thrive in. So, how often should you be doing these exercises? For the best results, consistency is everything. I recommend doing this routine once a day. It only takes about 10 minutes, so it's easy to fit into your morning or evening. When you're in the acute phase of pain, be extra gentle. As you start to feel better, you can gradually increase the intensity or the hold times of the stretches. Listen to your body, it will tell you what it needs. Don't push into sharp pain. A good stretch feels like a comfortable pull, not a stabbing sensation. Most people start to feel significant relief within a few days to a week of consistent practice. By combining these 3 targeted exercises with better daily habits, you're not just temporarily relieving pain. You're addressing the root cause and building a stronger, more resilient body to prevent it from ever coming back. You have the power to fix this for good. Thank you so much for joining me today. I truly hope these exercises bring you the relief you deserve. Remember to be patient and consistent with yourself. If you found this video helpful, please give it a thumbs up. It really helps the channel reach more people who might be struggling with similar pain. And don't forget to subscribe and hit that notification bell so you won't miss out on more tips to help you move better and feel your best. Take care. I'll see you in the next video.